welcome to this. Is the first FMER webinar of this year. We will have three. We have a schedule 3 from now to April, and we have the pleasure to welcome Ziyue Wang. You know that he graduated from our PhD program last year in 2025, but we are welcoming him today because he's co-recipient of the 2025 Pierre Pulley Awards in the stream of Best Paper of the Year. Okay, so the second co-recipient is a physician from Malaysia. She will be presenting in April. But we start with Ziyue. Well, he had training in health policy and healthcare management in China. Then he came here to Montreal for his PhD, and now he's working as research fellow at the Brocher Foundation in Geneva, in Switzerland. And the paper he has been awarded for is titled Evaluation of the McGill-Tongji Blended Education Program for teacher leaders in general practice, the importance of partnership and contextualization in international primary care training initiative. Is a paper that was published in Healthcare Science in August 24. So I think without further introduction, okay, Ziyue, the Zoom floor is yours. Okay.
Thank you so much, Carol.
Maybe a question, Ziyue. Would you like that people, if eventually ask you questions during the presentation or at the end?
I prefer during the presentation.
During the presentation.
We also can do it in the end. Yeah, like if you have any question, feel free to interrupt me. Maybe sometimes I cannot see people raise their hands. So Charles, if you say something.
Yeah. Don't worry. Denise and I will take care of that. Okay.
Yeah. Thank you.
Okay.
Let me share my screen. Thank you. Can everyone see it? Good?
Okay. Good. Yes.
Thank you, Charles, and thank you, everyone. It's good to see you again, and it's so good to see so many old friends and new friends as well. And it's very dark outside now. It's like 7 in Geneva now. It's such a pity cannot show you how beautiful Geneva is. Yeah, so it's a very nice place, and I don't know if all of you have visited, but if you don't, please do. Yeah, so today I'm very glad to present you my recent paper. It's not recent, so it's a paper we published in 2024. It's titled McGill-Tongji Blended Education Program: The Importance of Partnership and Contextualization in International Primary Care Training. So as we present this Pierre Pulley International Award, I would like to pause to honor in memory of Dr. Pierre Pulley, who is an exceptional scholar and mentor. I also had the privilege of learning mixed method research under his guidance at McGill University. And what he really showed me that mixed method is not merely a study design, but a way of thinking. Is pragmatic, attentive to the complexity of the world, and beyond the methodology, he also modeled humility and scholarly integrity. And I believe his legacy will live on our work, our collaborations, and questions we continue to ask with openness and care. So, what's the motivation of this study? So as we all know that there's a global challenge of primary care around the globe. So these papers focus on a specific angle. We're talking about the training system for primary care physicians. So around the globe, I think there's in general, the training system for primary care is relatively weak. And there's a shortage of qualified GPs, as we all know, especially in low and middle income countries. So also we are lack of have very limited access to evidence-based training material in general practice, and especially so that's why we see low public trust in primary care. And what we trying to answer by this paper is how can international collaboration play a role in improve GP teaching capacity? Can they do something? And if they can, how? So this study have 3 objects. First, we're trying to evaluate what we call Tongji program, a blended learning program to strengthen the teaching capacity for primary care physicians in China. Another thing, object 2, we are trying to assess its impact. Number 3, we're trying to identify if there are any influencing factors that make it success or become a barrier. So before we jump in, let's talk about a little bit about this program design. So this has it's a two-part component structure. I like to say it's like a bicycle with 2 wheels. So like firstly, we have a 12 months online course, which another thing is we call it 7 to 10 days enrichment component. So the online course is mostly about the faculty development in general practice. And we have about a tiny part talking about chronic disease management and other clinical skills. So it also has, like asynchronous lectures with interactive questions, and they also have writing assignment. People have discussion forums you can discuss, and they have virtual face-to-face meeting every week for 2 or 3 months, 3 hours. So for the enrichment component is more in person. So they have simulated doctor-patient encounters, they have workshops, they have critical observation in clinics, and they also have residency teaching assessment. So how we evaluate this specific program? So our design is a mixed method exploratory longitudinal case study. So we use both quantitative survey and qualitative focus group discussions. So we have 22 participants in this program, and they all complete this training. And for quantitative part, we use descriptive statistics, and the qualitative part, we use semantic analysis, and we use triangulation and weaving to get the result together. So the timeline is like this study, actually this training started in 2020. And after like 1 year of training, they studied these 12 modules, and we have interviewed all the participants and Tongji leaders and also the McGill organizers. Then when it's completed, like we use this instrument, including community of inquiry questionnaire, McGill longitudinal family medicine experience questionnaire, and this paper was published in 2024. So who are these participants? Who are these 22 people? So actually 21 of them were female, which is quite surprised me. Yeah, and their mean age is 24, so they are relatively young. And most of them complete their residency in family medicine, and most of them have had online training before. And for the teaching experience, I would say most of them have little teaching experience. Even one of third or 1 in 4 people even have less than 1 year teaching experience. And most of them are not paid to teach or supervise. So their working profile is like still mostly primary care clinical work, and about 11% of their time is in teaching. So let's talk about the quantitative result. So we first want to say how whether people are satisfied with the content of this training. So we found, yeah, most people say they are very satisfied. They rated this value or high or very high, and that means also you can see 100% participants complete all training modules. And when you see what their perceived impact, you find something very interesting. Like they do feel that they are better prepared in teaching, patient communication, collaboration. But if we ask whether you really use something in your practice, like direct observation, this kind of stuff, that means you can see the only 40% of participants really did this during after their training. So which means there's need for knowledge to practice. The gaps still remain. Also, we asked about the community of inquiry framework. We asked question about teaching presence, social presence, and cognitive presence, which means if the teacher is engaged, if the students are socially engaged, all the contents are relevant and cognitive challenging. So all these three looks pretty good. Okay, so let's go to the qualitative part, so which is really interesting. So we see that, okay, the satisfaction is very high, but we do see some discrepancy in the practice. So we try to understand what this project did well and what maybe need to improve. So we find some very interesting thing. First, we find the partnership is really the key to the high satisfactory rate. So actually, McGill and Tongji, they did a lot of things in the joint partnership model. So they have mostly joint meeting from the very, very beginning, and they share the curriculum design. They have a lot of mechanism to ensure equal decision making, and they have ongoing communication like every month or twice a month. So which all contribute to the high satisfaction. And we've also found that, especially McGill side did a lot of contextualization strategies. First, they translate all the material to Chinese, which is impressive. And also, they hired Mandarin-speak professors during the virtual face-to-face interactions, which really make people engaged and understand. Third, they use, because in the past, the server infrastructure is always a barrier. They find a local company to make the local server that hosts in China to bypass the connectivity issues. Also, they use a WeChat group for communication, which is a more familiar platform for the physicians here in China. So all this endeavor that increase the participation rate, and especially compared to previous program, it's really removed most of the technical issues. So we can see from their code, like here's a middle-aged program organizer at Tongji University. She said, my colleague and I were involved in the project from the very beginning. We did this McGill's clinical teaching environment. We also involved in discussion the project, such as topic and sequencing the modules. Another organizer at McGill University said everyone works very well. There's a good chemistry. I can't think of a moment that there's no sense of good chemistry. For the contextualization, we found something more interesting. Although with all these endeavors, like the GP, the primary care and doctor, the primary care physician in China still find some difficulty to apply what they learned in their practice. As this senior GP at Tongji University said, I think the main thing is that two countries are very different. There are few general practitioners in China. When we saw Canadian teachers introduce their consultation process and how many patients they need to see a day. We feel so inverse. We wish we could do much more, have more time to talk to patients, but the real situation doesn't allow it. Another thing we find also very interesting is how we're thinking about the contextualization. As we see here, a senior GP at Tongji University said, in fact, I think course, the highlight of this course is the word is diversified. I do not recommend the course to be completely localized to China because then you cannot reflect its international characteristic. That means the physician in these communities don't have an opportunity to see maybe this cannot see these views now, but it's not their personal problem, it's a systematic problem. But still, it's very meaningful for people to know it, to feel it. It's something new to us. So it's no matter it's a eye opener or whatsoever, it might inspire you to practice later. So how was our result compared to other global evidence? We found I would like to highlight, I don't have time to go to too much detail, but I would highlight a reference study from CRU, and which is titled Strengthening Primary Care from Family Physicians Around the World. We also studied seven countries, and we found something very similar, but we also kind of questioning and extend their framework. They find four things very important in strengthening primary care around the world. First is committed partnership, which we covered. Another thing they said is contribution of champions, which means leadership. The leader have a vision. You really want to push things to work out. Another thing is health policy support. They're talking about more the macro level, that the government or the institution policy really enabling the family medicine to growth. Also, they talk about the adaptability. So what we found here, yeah, partnership important, sure. And dedicated connectors and leaders are important. Also, there's a policy shift in China since 2009, which become a catalyst for these international collaborations. What we really find interesting is this cultural contextualization things. I think one of our key contribution is if the contextualization is essential, who is empowered to define it? Is the trainer or the trainees or the recipients? It's like who has the responsibility to make it really work in the local area? Is the McGill, is Tongji, or is both? So I think that's something really we need to reconsider. Of course, this study has a lot of limitations. I want to let you know. First, it's a sample size is quite small, and it's only in Shanghai. Shanghai is like the most advanced city in China, so it has a little bit limited generalizability. Also, the follow-up period is not, we don't have many follow-up with it, so we only have the post-evaluation. So also we can measure the behavior change. We didn't collect data for this. Another one is self-reported data. We all know self-reported data has many issues. It's a potential social disability desirability bias. There's no objective assessment. Also, this is very context specific, as we say, may not apply to other developing countries. So with Shanghai also have their very specific context. However, the conclusions we will still say is feasible to conduct this type of this kind of training, this kind of international training, and it can be very effective in terms of satisfaction and completion. Also, this model might be replicable in other international partnerships. So so in the end, I would like to thank all the funding that supports this project, and we have special thanks to Charles, to Dr. Wenhua Wang, and who who also participated in the previous Shenzhen evaluation, and we want to thank all the participants. We also thank McGill Family Medicine Educational Research Group, which hosts this seminar and hosts this award. So any question, I'm happy to take any question now. Thank you very much.
Thank you. Thank you so much, Ziyue. So yes, the period of questions is open. Or comments? Yes, go ahead, Kate.
Thank you so much, Ziyue, and it's so nice to see you. My question is really, I mean, it's the question that you posed when you said, you know, one of the major findings is that programs like this need to be tailored to the cultural context, but then you kind of posed rhetorically the question, who is responsible for that then? Is it McGill University? Is it the learners? So I know that you're limited in your ability to speak to that because that wasn't exactly the focus of this, but I'm curious of your educated opinion on that issue.
Yeah. That's something I find very interesting because I didn't expect that when I do this study, because you know, as we always say, like contextualization is important. We should make it workable in the local context. But I kind of feel like, I mean, local people also need the motivation, right? They also need the like the agency to really make it work and really want to learn and make it work. So I think this is not a one-side question. So it's not one side, I want to teach you about this, I want to teach you about that. Yes, you should think about their priorities, but also if their priority align, and if they have the same vision, if they have the same issue, I think also the local people, as this have showed here, as Tongji have showed here, also need to contribute to the partnership, right? They also need to show the agency that we can do things, we can improve, we can make a contribution, and we can really adopt things, adopt good thought, good practice in our own setting. Because anyways, it's like I firmly believe it's local people's responsibility to treat local issues. Although international help is very important, but I think agency is something we kind of omitted in the current literature, and I want to highlight more here. Yeah. Does it answer your question? I don't know.
Anne, go ahead, please.
Hi, thanks. Thanks very much. That was fascinating. I had a question. You alluded to it actually at the beginning, that 21 of the 22 were women. Does that reflect the sort of balance, the gender balance in primary care in China, or is it are there more women than you might expect?
So thank you for that question. And actually, I don't have a statistic now in my hand, but based on my understanding, yes, it's in primary care sectors in China, there are more women than men, but definitely not 95%. I think, yeah, first, it's a very small group, and you know, there's a selection bias, definitely. Another thing is what I also put in the paper, but I didn't put it here in the slide. We really need to understand like why more women want to participate rather than men. Are they more, you know, motivated, or they have other motivations? So generally, I feel, which is sad, but it's true, like especially in China, if a sector is more, you know, considered as low rank, not that important as primary care, usually they have more women, which is very sad, but in many cases it's true. So I think there might be some difference between the man who choose primary care and the man who choose to be a specialist, like surgeon or cardiovascular for cardiovascular disease or something. Yeah, so maybe they are less motivated to learn, but this is not. I have no evidence for that. So this is definitely something we need to explore more. Yeah, thank
If
you.
I'm allowed a little supplementary question, how did the 22, how did they come onto the program?
Yeah, so I think firstly, so this is how it works. Firstly, they select 3 community health center. So they send a message to all community centers that are affiliated to Tongji University, and in the end, 3 decided to participate. So, and they also send the message to all the primary care doctors, primary care physicians in their center. So if you want to come, if you want to participate, please come. So this is all voluntary. So it's not like we are require all of you to come or something. Yeah, so these are all voluntary. So they want to learn something, they want to participate, they want to make this 1-year commitment, so they come.
Okay. And maybe the women were more prepared to make that commitment. I don't know. Maybe.
Maybe.
Okay, Roland, thank you. Thank you, Anne. Roland?
Yeah, thank you, Charo. Just a comment and a question. First, to say congratulations because, well, for several reasons, you won the award. You were able to, I think, the people who implemented this program actually did it in the context of a pandemic, in the context of language barriers, which is really very impressive. So that's my comment. And I wonder if you could show slide 10. I had a question about something I saw on that slide. Is it possible?
Yeah. Let me go back.
Yeah.
Oh no. This is, let's go back. Okay, here we are. Is that the slide you're talking about?
Under the senior GP's comments at Tongji University, we felt so envious. That word is a strong word and a strong feeling. The context of general practice in Shanghai is unclear to me. How many patients? I mean, there's a question here, but I need to understand, like, how many patients is a GP typically seeing in a half day, for example?
Yeah, so I cannot say for everyone. This is from what I understand from their interview, which I didn't put it here. So they usually during the weekend they will have more patients, and weekday they will have less patients. But in general, on 1 day they will have 50 to 60 patients per day. So
Right.
which is a lot. Yeah.
Yeah, that would be easily double what we would be expected to do as family doctors here in Montreal, for example. So that pace of work is very, very fast. And that means that the training materials that one might design if you were a Canadian or a Montreal-based doctor would have to be contextualized, I think, for a different reality in China. And so my question is, to what extent did the GPs at Tongji contribute to the development of the curriculum, the modules, for example?
I think before they start, this is what I learned from our evaluation and survey. Before the start, like for sure the leader of the primary care centers, they met and they expressed their needs and try to understanding the needs of each other. So I think one thing is because it has been done this project has been done in other places and in other countries as well. So what they clearly express is we would like more faculty developed module rather than clinical one. We still need like 1 or 2 clinical module, but our main focus is how to empower the GP to teach, to educate, and to to mentor other GP residents. So this is from the very beginning they communicate. But the thing I find it maybe not doing very well is like the first line GP practitioners did not involve in the first at the very beginning. So they all yes, they have some questionnaire for the first line GP, like what do you want to learn, what do you want to teach, but that's happened after like the MOU is signed or most of the program is decided. So they do have a pre-training questionnaire to understand the need of training, but I don't think that's really play a role in the design. So of course the leader of community health center express their needs and concern and whatsoever, but I think the first line worker need more voice. Yeah.
Yeah, good. Thank you. That's very clear.
Thank you. Thank you, Isabelle.
Yeah, thank you. You really good and super interesting work that you did. I have a few questions for you. How are organized community health center? In particular, I'm thinking of interdisciplinary care because I guess that in Quebec we have really a strong interdisciplinary care process in primary care with nurses, social worker, pharmacists, and so on. And what is the context in the community health center that you interviewed, and how the program was adapted to these different realities or need to be adapted to these different realities?
Yes, thank you. Thank you very much, Isabel, for that question. So I would like to say for this case, we are only talking about Shanghai because Shanghai is really kind of advanced in China. They are, they are moving faster in terms of reform and other stuff. So they also trying to build their like family medicine group, or they try to sign contract with the patients that you have your own family doctor. You also join a group with nurse, with pharmacist, with doctor, with all these guys that working together. So this their aim and their goal. So I think this very, very close to what we are doing in Quebec. So they have the same, same issue, same vision, and they are seeking very similar solution. So, but the kind of like the problem is because they're still kind of underpaid, so they have a short of hand, so they cannot always guarantee that their group have enough people. That also they cannot guarantee that these people are really working together, because this idea still relatively new. I think people are still trying to explore how should they working together really to benefit their patients, but they already have some policies that that already have some policies that promote this kind of practice. So I don't know if that answers your question. Yeah. Thanks.
Any other question, Isabel? No? No? More comments? Questions? I would have a couple of methodological questions and then a comment, if you don't mind. Obviously, the paper is published in a high impact factor journals in the field. So, but my first question would be, it seems to me you didn't consider a theoretical framework for this evaluation. And you mentioned the limits of generalization of the findings of your study. do you think that you would have this possibility to theoretically transfer the findings of your investigation if you would have used a theoretical approach? It's about leadership among primary care physicians, it's education. So what do you think? It's a reflection ex post, okay?
Yeah. Thank you, Charo, for that question. Yes, I would like to say, to be honest, at the very beginning, we didn't think too much about the theoretical framework, for sure. So I think this is later what we found, like this 4 enabler framework is really echo to what we say in our study, but we find it later after we get the data and we analyze the data. So that's definitely, that's a shortcoming for sure. What I think is transferable, because this project has been conducted in other places as well. So I think what is transferable is really they have done a lot of things to overcome these logistic barriers. Yeah, so they really show a feasible way how to make things work, especially with all this technical issue, with time difference, with different context, different practice context, and how to also the language barrier as well. So like in the very beginning, because with all these issues, many project before the Tongji one was little or not successful at all. So I think also, as you also evaluate some other project, I think you already know that. What I think is really valuable here is they show how like the group really did a lot of and make a lot of endeavor to reiterate the project based on previous evaluation, previous feedback, and how to also focus on previous issues that really become a barrier of the teaching. So the project itself is involved and it's changed every time they teach. So that's something I find very useful in terms of practice. In terms of practice, that's something very valuable, especially in today that we are more on online stuff like this workshop. We have less and less in-person activities, and how this blended learning can still play a role, can still make a contribution to the primary care training and learning. That's something I would like to see. Yeah.
Okay. Another question is, and it's also to my colleagues, is there this program is still in place in our department? Is still there is? I know that in Brazil, Tibor, I think there is a similar partnership with people in Brazil, but this was, I think, 2 or 3 cohorts of students from China, and we have stopped. I haven't. Do you know if this program is still in place in the department? I'm asking that because for you, what you have said in one of the slides, agency is the creators of the program and the teachers and the trainees. Is there any lesson that conceptors here and teachers here in Montreal, there is some lessons that they learn from this experience that you evaluated that could be put in place also in following editions of the course?
Yeah. I would like to echo to that question first. If someone knows something else, please feel to add up. So one thing I find very interesting is one of the first project of this series of projects they did in Shenzhen, right? In Shenzhen, China. That's a long time ago.
Yeah.
And when we revisited Shenzhen, and because Dr. Bergman trying to build a connection with Hong Kong University Hospital in Shenzhen, and they are interested in this program. They are thinking about continue. And what we find very interesting is the participants of the first Shenzhen project.
Mhm.
some of them have already become a leader of their community hospital. So which is very, inspiring. Yeah, because at that time we have so many issues. We have language barrier, we have technical issues, like the format is not really ideal, but people still seem to learn something, and it really inspires them to continue their primary care practice. So this is something I find very, that's something we find it make us very happy. So I do not know anything else. Is that everyone have other, have other comments? Please go ahead.
Yes.
Yeah, I raised my hand, Cheryl.
Yes, so go ahead,
So,
Roland.
I mean, to my knowledge, it's not going on, but I may be wrong. I think if you're talking about helping teach teachers how to evaluate trainees in family medicine, right? I think you really have to understand the context in which the teachers are working, and I guess from previous comments, I heard that there may not have been enough input from people on the ground when they developed the teaching modules. I think co-development of these modules would be extremely important, and maybe the lead for development should come from the local people with some involvement at a consultant level, let's say from people in our department, because if the context is that you're going to see 50, 60 patients a day, and the patients may not know you because they're not registered to you. There's no kind of strong connection between doctor and patient because the context is different in Shanghai than in Canada. I mean, that says a lot about, well, what exactly are you evaluating? Are you going to change how you evaluate? Which skills are you going to put emphasis on? And so I think the lessons, you asked an important question about lessons learned. I think it's to maximize the involvement of people locally in the development of these training materials. That would be my comment, Cheryl.
Yes, I would agree with that. Ziyue, what do you think? Actually, and the need for participatory science, particularly when I'm working with other in other world contexts, that I think can be a cross-fertilization and to learn one each other. But yes, there is a more balance, power, and then agency, and at the end of the day, effectiveness as well of the intervention, even if it seems that this initiative was very successful at that level, but definitely to maintain the pace and the interest in this type of programs through an international partnership. I think yes. I see. I'm not the expert in that, but participation science would be the way to work. Tibor, you had your hand.
Yeah, up and down, up and down. I just want to try the AI. Sometimes it doesn't do it. Yeah, I just want to say on this partnership question, in April, the dean of the Tongji School of Medicine will actually come to Montreal, and we will have a meeting with him, with Marion. I guess Kate is also invited, I guess. So it would be a good moment, in fact, to check in and see. So what's the appetite? What happened since? I think COVID was a big breaking point, and same is true with the Brazilian partnership in terms of the medical education component. I think a lot of resources were put on hold with COVID, and then reignite this engine. I think this is really something where I guess this group could also be a catalyst, right? And this talk today was, I think it's a great testimony of what has been achieved, so we can build on that.
Definitely. Thank you. Thank you so much.
Thank you.
Thank you very much, Tibor.
Any further question? We have still a few minutes ahead.
So if I might echo a little bit to Roland's comments and also
Sure. Go ahead.
comments. Yes, I think like everyone here know, like there's a evaluation, like a 4 level of learning stuff, right? So we only evaluate on the satisfactory level. So we didn't do any behavior or organizational change level. Definitely, this is only the first step. So for sure, I firmly believe that the co-production, the co-design is a way to go. If we really do that well, if we really build that maximum, not only the partnership, not only at the leader level, but also as a first line worker, this level also involve more people in. I believe there will be some very promising and encouraging result later. So also, as Tibor said, this is the first step, and we are still continue to discuss this. Maybe, yeah, that will be a next way to go. Thank you. Thank you very much.
Thank you so much. We have to leave. There are people. Okay, don't worry, Tibor. Okay, thank you.
Thanks, Ziyue. It was great. Bye.
Bye. Bye. Bye. No more comments on. Okay, people are leaving. So, anyways, thank you very much. Ziyue. Has been very nice seeing you on a screen again. To see how successful are these type of initiatives, that I really hope that this will have a future, and the knowledge that you have generated can be a good insight for future projects of this type at the international level. Maybe I see that Howard has joined us. Would you like to add something? Because you were the promoter of these initiatives. So just to close this seminar.
Yeah, sorry, I was in clinic this morning and just
Don't worry.
finished. So I missed it. But as everybody knows, this was part of the distant blended learning program for international. And this was actually the second evaluation we did, because we did an evaluation in the program in Shenzhen in 2019. But this was really the best evaluation, and which led to a publication. So we're very happy about that, and hopefully draw upon lessons of continuing to develop our international education programs.
Exactly. Is the point is what Tibor has said, that we will receive visits from China in April?
Yes, so the dean of Tongji Medical School, Jialin Chang, is coming for a few days, and he's going to be meeting with Marion and other people from the department, coming over to the department.
Okay.
I forget on which day, but yeah. And there's lots of opportunities for development with China. There's Tongji, and there's Tsinghua University, which is the #1 university in China.
And in China, yes, I know.
And whose dean, just like Jialin Cheng, the dean of Tongji, is very interested in developing academic family medicine.
Okay.
Very few deans think that way. And so there's opportunities for joint programs, but there's also opportunities, I think, for attracting graduate students, because the United States is more and more closed to them. So I think there's an opportunity for attracting master's and PhD students. And we just to close, we're going to have a visiting professor from Tsinghua, who's a geriatrician and neurologist, and she's going to be here for a year, starting probably in July. And maybe we can have some interaction with her, because she's also very interested in medical education as well.
Perfect.
I'll let you know.
Happy that the FMER get somehow involved in all
and
this.
Maybe she can give you a talk as well. Okay.
Okay, so thank you very much. Thank you, Ziyue. Again, very happy to have you. And just to recall you that we have a second webinar organized by the FMER this year on March 17th. It will be with Dr. Kathleen Rowland from Chicago, right, Roland? She will be talking about evidence-based medicine and the difficulties to teach evidence-based to medical students and residents. Okay, so have all a good night for you, Ziyue, and
enjoy the rest of your day, and Happy New Year to you all.
Okay,
Thank
that's
you.
true. Happy Chinese New Year. Bye bye.
Happy